I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida. Let me know if you can hear me okay. Tonight's topic is toxins, Ta-Tas and testing with quantum. And so I was just chatting with some of my students in the Quantum Nutrition Academy and having a great time hearing their wins, everything from helping patients with nasty migraines, kids with headaches. Let's see what other wins. Throat issues, respiratory issues. Let's see, pressure in the head, vaccine injuries, ADD, ADHD, heart palpitations, so many wins. Hi, Keely. That must be Jonathan. Hi, Jonathan. And so, so many wins. And we were discussing how people end up with diseases, people end up with symptoms, people end up with medical conditions because there's imbalances in the body, right? If a body in balance, a body in optimal health has no symptoms. And so if you have headaches, migraines, PMS, bloating, diarrhea, constipation, if you have symptoms, then you have imbalances in the body. It's as simple as that, right? So then with quantum nutrition testing, which is a technology that I developed and a technology we use at our office here in Central Florida, we look for what causes the imbalance, right? Hey, Amanda, we look for what the heck happened. What was the cause? And many, many times the cause was a toxin, right? What is a toxin? Toxin is a chemical. A toxin is a pollutant. A toxin is a metal. A toxin is something that does not belong in the body, right? Where do the toxins come from? Where do you get them from? You can get them from inhaling toxins like car exhaust. New furniture, the new car smell is toxins. I don't like the new car smell. So my husband's like, oh, your truck has, I have a Highlander, has over 100,000 miles on it. And, it's got this and this and this. I'm like, I love my truck. I love it. Doesn't stink like new car smell. I love it. It runs fine. I love my truck. I don't care how much mileage it's on, as long as the engine's working well and I get the oil changed and use synthetic oil and all that stuff. I love it. I don't have a problem with it. I don't want the toxins of a new car, and I definitely don't want the radiation toxins from Wi-Fi and Bluetooth and smart technology and all that either. So toxins can come from chemicals in the air we breathe, the water we drink. Oh my goodness, so much stuff out recently in toxins in water. You can go to ewg.org, www.ewg.org. That is the environmental working group. You can put in your zip code and see the toxins that are in your water. Toxins in our food. Organic vegetables and fruits still have toxins. They are still sprayed with chemicals. I had a patient that sold organic fertilizers. I'm like, okay, well, organic is no chemicals. And she's like, what do you mean? I'm like, yeah, when you buy organic, it means no chemicals. And I think a lot of people have that definition. And organic does not mean no chemicals. Organic means less chemicals. And different countries have different definitions of what those chemicals can and cannot be. And so patients are like, I'm not toxic. I don't need to detox. I eat organic. Yeah. Okay, you eat organic, but your organic food has chemicals, your air has chemicals, your water has chemicals, you bathe in chemicals, your furniture off gases, your car off gases, people spray their yard, people spray their house, just so much exposure. Women, I used to highlight my hair, so that's chemicals. If you get your nails done, that's chemicals. If you get, what's it called? The fake nails. If you get your nails done, if you get there's a special call. I don't get it done, so I don't go to nail salons. Actually, if I'm near a nail salon, I'm usually like walking really fast because I hate the smell of nail salons. Chemicals. Men, aftershaves, chemicals. A lot of shaving creams and lotions, chemicals. What else do guys do that's chemicals? Even like, working on cars, One of the sickest patients I ever had was an artist. She kept sticking her hand through her paint, and she was picking up chemicals and metals that way. Cindy says acrylics. Yep. So acrylic nails, chemicals. And so I am not telling you guys to not do you. If I had a patient, she loved her red hair. And she's like, Dr. Palmer, you don't understand. My red hair is what defines me. And I'm like, patient, you don't understand. You keep showing for toxins and chemicals and dyes, and your dye is killing you. And she goes, well, that's my signature thing about me, and I'll die with red hair. And I'm like, okay, well, you'll die with red hair, like. So I'm not telling you to never get exposure with toxins. It'd be good if you've reduced your toxic load. And we can do that with products from Cellcore like Virachem binder, biotoxin binder, HMET binder. So HM is heavy metals, ET is environmental toxins. Binder binds those. It could be a biotoxin binder, carboxy. It could be good for people to do a binder every now and then. Some people do binders daily to bind up toxins in the environment. But in order to handle your toxins, your detox pathways have to be open. You have to be a good pooper. Hey, Kayla. You have to excrete toxins out of the liver. The liver is like a big filter that filters out toxins. If your liver is clogged up, you're not going to break down hormones properly. For a female that looks like PMS symptoms, breast tenderness, bloating, clotty periods, crampy periods, you're not supposed to have that. A menstrual cycle just means that you shed the uterine lining. It does not mean all those other things. If you have those other things, there's imbalances. And what causes imbalance? That's what we look for. If you are toxic, you may have immune challenges. You might have bugs that are bothering you, like parasites. So Jonathan's asking me if today is a new moon. Absolutely, today is a new moon. Our moon, also known as Luna in Spanish, coming from the lunar cycle. Lunatic means crazy. The derivation's crazy, right? So if you ask an emergency room, a professional, a nurse or a doc or a tech, they may tell you that their visits around full moons are increased. More babies are born around full moons. Tides change around full moons. Farmers may decide to plant or do certain actions around full moons, right? So I thought naively, ignorantly, I thought that moons were stupid. And why should I study anything with planets and moons? I'm studying the human body. I'm studying sports medicine. I'm studying nutrition and chiropractic. Why should I care about moons? And the more work I get into alternative medicine, the more work I work on unusual cases where Mayo Clinic, Cleveland Clinic, Shands Hospital, local specialists are uncertain. We're getting results because we're looking at things that other places are not looking at. Hey, Amanda. Hey, Heather. We're looking at the things that get missed. So whatever reason in the United States, American physicians are not very well trained in parasites. Florida, we have parasites down here in Florida. Wherever you're from, there's parasites there too. And parasites can go anywhere in the body. They can go in the eyes and may appear as floaters. They can go in your ears and give you challenging hearing. You can have headaches and migraines. They can get into your lungs and cause lesions. They can get into the brain and cause lesions. They can get into your digestive tract. So I think most famously, they're known as causing digestive issues like Montezuma's revenge, having a diarrhea episode or vomiting episode definitely could be parasites. They can get into your muscles and cause muscle cramps. They can get into your bloodstream and eat your red blood cells, causing an anemia. They're just nasty, nasty, nasty creatures. And for whatever reason, American medical staff just really are not trained that much on them, unless it's an infectious tropical disease doctor and then they've had specialty training in some of these. Whereas if you go to Jamaica or you go to Haiti or you go to India, or you even go to different places in Asia, some of those practitioners will do annual parasite cleanses with their population. Some of these island cultures will do yearly parasite cleanses as a family. It was just part of what they did, right? Why? Because they know that we pick up parasites. How do you pick them up? They can enter your feet. They can swim into any hole in the body. You can eat them. You can inhale them. They're very, very, very easy to get in their midst all the time. And these toxins open the door and make it a very favorable environment for these bugs to live. When we're looking at other sources of toxins, you have Ta-Tas in the title. Breast implant illness is a real thing. There are so many female patients that I've worked on that were doing okay with their health. They decided to get breast augmentation with implants, and they're sick. They're inflamed. They're puffy. They're exhausted. They've gained weight. They feel bad all the time. They have headaches. They have digestive issues. They have problems sleeping. Like, so many female cases with, they seem to be doing well in life, and then they get the breast implants, and all breast implants leak. And I don't mean about the implant itself leaking. The body will absorb the plastic. One of the most eye-opening days is I had a patient who was a nurse at the Mayo Clinic. And he told me, absolutely, Dr. Palmer, breast implants leak. And I said, well, what do you mean? He goes, well, at the Mayo Clinic, we remove breast implants. And I'm like, oh, I didn't know that. And he goes, yeah. And I've assisted in those surgeries. And I said, really? He says, oh, yeah. And they absolutely leak. He said he was assisting a surgeon who was removing them, and they were scooping out the breast implant. It was just like water just dripping down their hands because the implant was no longer intact. And I said, well, what about mold? I've heard that, when there's implants in there, that there will be mold growth. And he goes, absolutely. They'll take the implants out, and then there's mold surrounding the implant, or there's mold in the cavity. And so these things do not belong in the human body. I'm not making you wrong if you decide to get implants. I'm not saying you're a bad person. I'm not saying you're a horrible person. I'm not making fun of you. I'm not doing any of that. I'm just letting you know, if you don't feel good, it may be because you have something in your body that doesn't belong there. Think about a splinter. You get a splinter in your finger. What does your body do? It tries to push out the splinter, right? When you have a foreign material in your body will encapsulate it and will also try to get rid of it, and it will break it down. So breast implant illness, those of you that have breast implants and you don't feel good, that is a real thing. What do we do with that? Is we help clean up the toxins in your body. We help to rebalance the body. We help to strengthen the body. Sometimes the female patient is so exhausted, we can't detox them first. We have to work on the mitochondria and the cell and get them energy so they can even think about detoxing. And then we got to support the kidney, or we got to support the liver, we got to support the lungs. And then when we do that, then maybe we'll be able to detox them. And then maybe they can look at having an explant done by a surgeon that knows how to properly remove implants. The implants are not only a female thing, though. There are men that get implants. They get butt implants. They get calf implants. They get we have some younger people on here, so I'll just call it other implants. And those implants also can cause problems in men. And that is not talked about as frequently, because I think a lot of men that have implants are pretending like they don't have implants. But yes, they can have similar symptoms to females with breast implants. So then with these toxicities, how do we determine them? We can do a hair analysis. We can do a metal or a chemical detox panel and look to see what's in the system. We can run thousands of dollars of blood work if that's your thing. I don't prefer that. A lot of the cases that we get, they come to us with a lot of lab work done. They come to us with a lot of blood work done. And many times the blood work really didn't give us a good indication of what's going on with the case. Instead, I like to use quantum nutrition testing that enables us to apply the technology to look for the cause of the problem. Was it a chemical in their water supply? Was it a heavy metal that they were exposed to? Is it breast implant illness? Is it coming from the pesticide that's sprayed in their lawn? Is it coming from an old procedure that they had? We'll just say that. Where was the cause? And then what is the exact right supplementation to rebalance out the body so then the body can heal itself, right? So with quantum nutrition testing, we're not curing, we're not treating, we're not diagnosing. We're instead looking for imbalances in the system, looking for what caused the imbalance in the system, looking for the exact right whole food supplementation, homeopathic, carbon technology, or herb that we need to help the body with in order to get it into a healing state. That's what we're looking to do. And so I encourage you guys, if you if you need our help, if you know someone with breast implant illness, if you know someone that has headaches, if they have horrible migraines, if they have stomach issues, digestive issues, if they have eczema, if they have rashes, if they have any of those things, I'd encourage you to reach out to us. Let us do a consult with you so we can determine what is the cause of the problem. Figure out what the cause is. If we can figure out what the cause is, then we can figure out how to rebalance the body. And if we can rebalance the body's optimal state is in a state of health. And then what tends to happen is those symptoms go away. And so if we can help you, please reach out. The number is 407-682-8444. Right now we have a March special. It's only $144 for your initial consult, for your family history, your medical history. We even get into dental. Sometimes we are not dentists, but we do like to find out if you have mercury fillings or amalgams, if you've had root canals, if you've had implants. We do get into, if you're female, any pregnancy history, any accidents, any mold exposure, those types of things. We talk about that. We then take that data and we perform the quantum nutrition testing to determine the cause of the issues. We have a second appointment. So the 144 includes a second appointment to give you a report on what the findings were, how the program works, and what the program costs, what we expect of you as a patient, right? So this is not just, take some stuff and run away. This is, we got to find the cause. If it's coming from something in your life, we're going to help you with a solution. We're going to help you with any food questions that you have. We're not going to give you a diet plan, but instead we're going to teach you the foods that you like to eat that are beneficial for you. And then we're going to teach you the foods that might be causing problems, that may have chemicals, that may have metals, that might have red dye number whatever and yellow dye number whatever. Hey, Jessica, she says, don't get root canals. Yes, I agree. And then you make the decision on whether you want to work with us or not. And if you do want to work with us, we ask you to make your appointments, which are 10 minutes or less. We ask you to take supplements, and we ask you to make some lifestyle changes. And if you agree to that, we can help you if you want to get better. Some people don't want to get better. It's really weird. But if you want to get better, you have supportive family members, you want to do those things, we have great results. If you don't want to get better, if you don't have supportive family members, if you don't want to do any of those things, then don't call us, because you won't get better. All right. So hopefully that helps you guys. I hope you have an amazing week. If we can help you, let us know. I'm Dr. Lisa Palmer, Dr. Mama Bear. Have a great night, everyone. Bye.